Medication management is a critical part of providing care to your clients. This involves providing clients with not only their routine medications, but oftentimes their PRN medications as well. While most medications given in the facility are given on a routine basis, such as once a day, twice a day, 3 times a day, etc., there are oftentimes medications that must be given PRN. PRN refers to a Latin term, pro re nata, which literally translates into as needed. So in other words, a PRN medication is not given at the same time every day, but rather it's given to the client when they need it, such as taking acetaminophen for a headache or taking aspirin for back pain. The medication is taken when the client has the symptom that needs to be treated. It's not always taken at the same time or even necessarily taken every day. Managing PRN medications can pose several unique challenges compared to routine medications. The first challenge is knowing when to take the medication. Because it's not given on a fixed schedule, we must be able to determine, working with our client, when they need the medication. In the simplest case, the client will be able to tell you when they need the medication, but oftentimes, due to dementia, mental illness, or other impairments, your client may not be able to simply tell you when they need the medication. Another challenge with PRN medications is avoiding overuse. Oftentimes, these medications are pain medications, perhaps even narcotics, that can have addictive qualities to them. Our clients are at risk for becoming addicted to these medications, taking them more often than needed, or wanting to take them more often than needed, which of course can pose serious potential side effects and adverse reactions. An additional challenge with PRN medications is documentation. Typically, there is more information that must be documented with PRNs than with routine medications, thereby taking up more staff time and lending itself to increased potential error. Effective management of your client's PRN medications is critical to the success of your facility. During this video, we will discuss handling PRN orders, how to properly administer PRN medications, and proper documentation after a PRN medication is given. Many of the PRN medications your clients will use are technically OTC, or over-the-counter medications. An over-the-counter medication does not legally require a prescription in order to purchase the medication from a pharmacy. However, within the confines of a facility where you are responsible for the care provided to your clients, a prescription should be obtained. While this is not necessarily required in every state, it is often considered a best practice. Be sure to check with your state regulations regarding the need for a prescription for over-the-counter medications. Obtaining a prescription helps to ensure that the client receives the most appropriate medication at the correct dose and at the correct frequency. So again, even though in some states it may not be required to obtain a prescription, it is a best practice that within your facility will help to ensure the safest possible medication management. Along those lines, we can sometimes have challenging issues with clients' families. Clients' families know that many of these medications are over-the-counter, and they may take it upon themselves to go to the pharmacy, go to their local drugstore, and purchase medications for their loved one. There are even situations where a family may bring an over-the-counter medication into the facility and not tell facility staff about this. It is your responsibility to monitor medication use within your facility. If you see medications in a client's bathroom, in their drawer, in their room, it's your responsibility to talk to them and talk to their family about how the medication was obtained, and then take the next step to speak to their physician to ensure a proper order or prescription is obtained. We also want to take time to speak with the family and educate them as to why we do not want them to simply purchase a medication from the pharmacy. Take, for example, two very common medications: Coumadin, a prescription blood thinner, and aspirin, a common pain reliever that can be purchased at your local pharmacy. If a person was to take Coumadin and aspirin at the same time, it could lead to very serious bleeding and potentially even death. So the well-meaning family member, or for that matter client, that went to the pharmacy and purchased some aspirin for occasional headaches may not realize that because they're taking Coumadin, they should not take that aspirin. Educate the family on these types of issues. Discuss with the family your procedures of speaking with the doctor and speaking with the pharmacist before any medication is given to a client. Help to ensure them that your procedures are not simply a nuisance, but a method of ensuring the best possible care for your client. Let's talk about the key parts of a PRN medication order. There's some information that is needed in a PRN medication order or prescription that you don't always find in routine medication orders. The first piece of information in the order, of course, is the drug. What drug is to be given to the client? Now keep in mind that some physicians will write the generic name of the drug, such as acetaminophen, while other physicians may write the trade or brand name, such as Tylenol. If you're ever unsure of a drug name or that you have the proper medication, check with your pharmacist. Next is the dose. How much of the medication is to be given to the client? We want the dose to be written in very clear, simple terms. If the physician writes an order such as take 5 to 10 milligrams of a medication, that is not clear. How are we to determine how much medication to give to the client? Speak with the physician and ask them for very clear, simple parameters, avoiding ranges that can be potentially complicated. Next is the route. How is the medication to be given? While most medications are given by mouth, meaning that they're swallowed, there are other routes of administration. There may be eye drops, ear drops. Some of the newer pain medications are given as patches that are applied to the skin. And of course, there may be injections. Consider with each route your ability to handle that particular medication. For example, in many states, regulations will limit our ability to provide an injection to our client. They may have to do it themselves, or a nurse may be required to administer the injection. Time between doses. Now, this is the part that really is unique to a PRN order compared to a routine medication order. Because the medication is not always given at a certain time, it's taken as needed, we need the physician to provide us with instructions for how often they can take it, such as every 4 hours, every 6 hours, every 10 hours, etc. So be sure to ask for the time between doses if it's not given. Along those lines, we also want to ask the physician for the maximum dose to be taken in any 24-hour period. This helps to avoid overuse and potentially serious complications or adverse effects. Finally, the reason for use. What is the reason the person is taking the medication? You'll often see the doctor list things such as PRN for pain, PRN for headaches, PRN for anxiety. Whatever the reason is, we want it to be clearly indicated in the order so that we know when the medication is to be given to our client. Just as with the PRN order, there are some similarities but also differences in administering a PRN medication when compared to a routine medication. The first thing you want to do is familiarize yourself with the client's PRN medications. Make yourself aware of what PRN medications the client is able to take so that you can provide the correct medication should a symptom or complaint arise. The next step in assisting with administration of a PRN medication is determining need. How to know when the client needs the medication. Once the medication is ordered and on hand in the facility, it then becomes the responsibility of the caregiver and the client to work together to determine when the medication will be taken. The first way to determine need is through verbal reports or complaints. This is also, of course, the easiest way to determine that the medication is needed. In other words, the client simply tells you that they need the medication. For example, I have a headache, I would like my Tylenol. If the client is able to accurately and reliably give verbal reports or verbal requests, this is the simplest way to determine when to give them their PRN medication. There are, however, other methods that can be used, but be sure to check with your state regulations to determine appropriate methods of determining need for a PRN medication. One of the most useful tools can be body language and facial expression. Does the person grimace when they're in pain? Do they hold or guard a certain part of their body, such as holding or guarding their stomach, indicating that they're having stomach pain or an upset stomach? Also, look at the person's behaviors. Many times, clients that for some reason are unable to verbally report their symptom will tell us, if you will, through their behaviors. They may become more agitated. They may seem more depressed or withdrawn. They may refuse to participate in activities. They may want to stay in bed all day. They may lash out at a caregiver who accidentally touches a painful part of their body. Look for these subtle changes to show you that the person is having a particular symptom and in need of their PRN medication. The next step, once you have determined that the client needs a particular medication, is to be sure to follow the parameters set in the physician's order. In other words, if the physician's order says to take the medication every 6 hours, check your documentation to see when the client last took that particular medication and be sure you are within the proper time frame and that you're not giving it too soon. Keep in mind, many PRN medications can have powerful and dangerous side effects if given too soon or given too often. Once you have determined that the client needs a particular medication, you have checked to see that you're in the correct parameters or time frame, prepare and administer the medication as you would any other drug. Go to your medication room, pull it from the storage area, do your 3 checks, and follow the 6 rites as you prepare the medication for the client. Then bring it to them and assist with administration via the correct route as you normally would. Once the medication has been administered to the client, document that the medication has been given. Later on during this video, we will show you how to properly document on a PRN medication record. The next step, and one that is particularly unique to PRN medications, is to follow up. Approximately 30 to 60 minutes after the medication has been given, go back to the client and check for their response. See if the medication has been effective. Whatever the symptom that was to be treated, check with the client to see if the medication has been effective. Again, you'll have to use some of the similar techniques we talked about earlier. If the person can verbally respond, then that's wonderful and very simple. If not, you'll need to look at body language, facial expression, and perhaps behaviors to help determine effectiveness of the medication. This step is critically important to be sure that your client is having their symptoms managed effectively. Does the medication work for them? Perhaps is the medication too powerful, causing side effects? This step of monitoring is a critical service you provide to your client. Should you see anything suspicious, if the medication is not working, if it appears to be causing side effects, etc., be sure to document this and report it to the client's physician for further instruction. Once you have determined the medication's effectiveness, document this as well, as we'll see in just a few moments. Just as you followed up to check effectiveness or response to the medication, you also want to monitor your client on an ongoing basis. Watch for any side effects or potential adverse effects of the medication, and again, should you see them, report it to their physician immediately. Let's talk about how to use a PRN medication record. First, let's look at the different parts of a typical PRN medication record. Now, the actual form used in your facility may vary somewhat, but these are the common components of a PRN medication record. At the top of the form, you'll see spaces to list the PRN medications ordered for your client. The number of spaces on the form varies, but typically there is space to list at least 4 to 6 medications. At the very bottom of the form is basic information about your client, their name, their room number, and any allergies known about the client. Be sure to check the allergy section before giving any medication, and be sure you have the form for the correct client when providing medications and documenting them as well. Next, if you look at the middle of the form, are spaces to list each time a PRN medication is given. Now, this varies quite a bit from your typical medication administration record, in that each time you give the medication, you will actually write the date, time, the drug, the dose, the reason the medication is given, and your signature. And as we said earlier, each time a PRN medication is given, we want to follow up approximately 30 to 60 minutes after to check for the response or the effectiveness of the medication. So once again, you will list the time, the response, and sign again. Now, when listing the response, you want to avoid opinion or what you think the response was or what you think the effectiveness was. So if the client told you, "My headache's gone," write on the form using quotes, "My headache is gone." If upon entering the room the client was sleeping, indicate on the form, "Client sleeping." Don't guess and say, "The medication worked." Simply put what you saw or what you heard. There may be times when a physician writes an order for a new PRN medication and it must be added to the form. Find the next blank spot on the top of the form and list all of the medication required in the prescription, the drug, the dose to be given, the time between doses, the maximum dose in a 24-hour period, and the reason that the medication is to be given. Should you make an error in your documentation, such as you mistakenly write the wrong date or the wrong drug name, you want to put a line through the error, write the word error, and put your initials. Do not scratch it out, do not obscure it with a marker, and certainly never use whiteout on any of your medication records. Once again, simply put a line through the error, write the word error, and put your initials. You would then go to the next blank space on the form and fill in the correct information. Every member of the staff in your facility plays a role as a client advocate, ensuring that clients' rights and needs are being met. In regards to PRN medications, you really have to ask yourself, is the medication working effectively? Are the client's symptoms being managed? And if not, here are some things to consider and discuss with the physician. Do they need a more powerful medication or powerful dose of a medication? Should the medication be given on a regular dosing schedule? If the person has difficulty communicating their need for the medication, but yet clearly is suffering from the symptoms indicated, perhaps the medication should be adjusted to a regular dosing schedule rather than being PRN. At the opposite end of the issue, are they on too much medication? Oftentimes we see clients that come to us from other settings, such as their home or acute settings of care, and upon entering our facility are clearly over-medicated. The person is nearly sedated by the medications that have been ordered for them. Perhaps we need to talk to their doctor about reducing the amount of medication that they're being given. While there is much to be learned, through effective training, practice, and mentoring from your experienced care staff, you will become an important part of the team in managing your client's PRN medication. Be sure to check for your proper physician's orders. Be sure to determine appropriately the need for the medication. And remember to document every time the medication is given. Don't forget to check your client's response and always be a client advocate. Your effective management of your client's PRN medications will help to ensure their comfort and safety while residing in your facility. Much success to you in managing your client's PRN medications.